Welcome, everyone. I'm Kelly Rosati, the president of Hope for Brighter Tomorrows, the mental health ministry of Kay Warren that provides our Breathe Conversation series as a part of our mission to strengthen families impacted by mental health challenges. We are so glad you are joining us today as we discuss child and adolescent mental health with information designed to help you as parents navigate the very complicated challenges that often accompany this topic. We are honored today to have with us two experts who are going to help us gain insights and practical tools for our children and families. And before I formally introduce them, I want you to know that I have personally been the beneficiary of their expertise with our own children, four of whom have very serious mental illnesses, including schizophrenia, bipolar disorder, OCD, major depressive disorder, and more. I can't say enough about how the care, compassion, and expertise these women provided our children and family felt literally life saving, and I am indebted to them and indeed have come to love them both dearly. So, with that, let me tell you about Dr. Rebecca Thomas. She is a board certified psychiatrist specializing in child and adolescent mental health. She is the chief medical officer at West Pines Behavioral Health Hospital in Westminster, Colorado. Dr. Thomas played a pivotal role in expanding psychiatric services for children and youth in Colorado by opening the first specialized unit for younger children designed to serve traumatized kids with complex medical needs. Recognized for her excellence in teaching and clinical care, she was named Colorado University's School of Medicine's Psychiatry Teacher of the Year. She is not only passionate about serving children and youth, but also cares deeply about the entire family and believes that communities do best as children and families are strengthened and supported. Rachel Britton is a licensed marriage and family therapist who specializes in helping children with mental health challenges and their families. She worked closely with Dr. Thomas at the psychiatric hospital that first expanded the access to care for younger kids. She currently serves as the program director for Flying Horse Foundation, which provides best in class equine assisted learning services to at risk children, youth, veterans, and formerly homeless moms. I often say about Rachel that she is the best person I have ever seen just intuitively handle kids with extreme difficulty and kids whose behaviors can sometimes seem very scary. She handles this with such aplomb. She is unfazed and yet always full of compassion and the love of Christ. And so, ladies, it is an honor to have you both with us.
It's an honor to be here.
Thank you. Thank you. We really appreciate it. So, Dr. Thomas, I want to start with you. How can parents know when their child is actually having a mental health challenges when it so often feels impossible to know what is a typical developmental um, behavior and what is something more serious? How do parents know how to tell the difference?
This is actually one of the most often asked questions of parents. Like, why could this just be a tantrum? Could this just be a phase? Developmental milestones often do come with mood swings and difficulty during certain transitions. What you want to consider is like a duration, intensity, and interference. Duration, how long has it been happening? Is it not just a few days where they just had a little bit of a meltdown and then they're good to go? Has it been happening for over a couple weeks to 3 weeks to 6 months? It's just really important. And as parents, we know our children and we know what the difference is because if we're questioning it, we know that there has been a change. You also want to know the intensity of it. Teenagers can be full of mood swings, and we absolutely understand that. But the behavior is out of context of the situation, and it lasts, and it's not expected, and it's never been seen before. And does it interfere with their life? Are they not eating like they were? Are they withdrawing? Are friendships falling off? Is their school performance going down? It's things that they were doing really well at are now regressing. And you also want to kind of compare it to same age peers. You want to know, kind of like, is this the same thing that their their older sibling went through or that their friend is going through? And biggest thing is just watch for any regression in those symptoms, in their behavior. And like I said, if you're questioning it, then you know that something's going on.
Do you encourage parents to trust their gut? We hear that phrase a lot. And I think for a lot of parents, they don't know whether that's something they should really do. They kind of feel a certain way and they feel like they know, but then they're just not sure. What do you think about that? Trust your gut.
Well, I think the person that knows their child the best is the parent.
Mm.
And so if you feel something's going on or you're questioning it or they're saying, no, mom, dad, everything's okay, you dig deeper and just show at that moment a level of love and support, but also kind of be an investigator in the moment as well.
Sure. Rachel, I'd like to just follow up on that with you and give you, I'm going to kind of list four things that I know we've experienced, but that I hear from a lot of parents. And I'd just love you to kind of give your sense about whether some of this is typical or some of this is should be more concerning. And so the things I just want to rattle off are four things that I hear about quite a bit. One is kind of an ultra defiance where it feels like as parents, your child like literally doesn't let you parent them. No matter what you do or say, nothing changes. So that's one. I hear a lot from parents about kids who just almost refuse to come out of their rooms. I mean, it is pulling teeth to get them out of their rooms. I hear a lot about the fact that sometimes consequences make no difference whatsoever. And then lastly, Dr. Thomas just touched on this, the whole what if they don't have friends in real life? So if parents are seeing some of these behaviors, how would you encourage them to think about those?
Yeah, I find all those behaviors very, concerning. Personally, I would definitely want to investigate further, and your kid's gonna push back either everything's fine, leave me alone, or with anger, maybe. But you could even start with your pediatrician first and check in with them and run some of those situations by them, and then they'll hopefully give you a referral to a therapist or maybe even a psychiatrist to check in with them, and give you some beginning things to try. Um,
That's great.
yeah.
So you definitely, if you're a parent and say that your child is exhibiting all of those four things I just said as an example,
Mhm.
that definitely would warrant some, okay, let's take this a step further. Is that what I'm hearing you say?
Yeah, absolutely, absolutely.
Investigate.
Yeah, I know people. Yeah, just investigate it because I know that sometimes they'll just parents tell me a lot that everybody just says, "Well, if you just did this, if you just did that, you're letting them get away with all these things." But if that were the case, then we wouldn't have any problems. Kids that are having suffering from some mental health issues, they don't respond the way typical kids might respond. They don't respond to typical therapy or parenting where you're gonna remove like you're gonna remove something from them or you're gonna add some sort of consequence. They aren't going to respond. So if you've tried all the tricks in your parent book and you're still having troubles, then that's the time to really investigate further.
That's fantastic. I love that. Dr. Thomas, back to you. So that's really helpful guidance. Now, let's say we're a parent who has realized, all right, I think something's going on here. Um, you've determined that these challenges are in fact present. What should parents know and do? Kind of give us a roadmap of the professional assessments and supports that they might consider seeking out in their communities.
Well, first of all, again, listen to your gut. But the biggest person that you have trusted in your child's life has been the pediatrician or the primary care provider. So, really seeking support from them at first because they have a bunch of tools that can help kind of narrow the field. So, like a screening tool for depression, a screening tool for anxiety. And, usually they are a very big trusted part of the care for your child. Listen to your gut and then just explain to them, start there as the first time, the first one. And then typically they will send you off for a mental health evaluation. So if you score high on like a what we call a PHQ-9 or a GAD-7, which screens for depression and anxiety, they will refer you to a mental health professional for further screening and interviewing. There's standardized tests for this. It is not just, oh, you look depressed today. Oh, you look anxious today. Maybe that's what you have. We do have diagnostic tools that help narrow down the field. And you also want to make sure that there's nothing medically contributing, right? So, depression can mimic anemia or thyroid issues. So, the pediatrician will do all those screening tests as well. And then just understand this is a team based approach. You are not alone. It might feel very much like you're alone, but this is where you start gathering the people that are going to support you and help you and lead you in the right direction. So enable your school. Talk to the school counselors, talk to the social workers there and really coordinate as a team. Reach out to your church if there are counselors there, because many are there as well to seek their guidance. Be careful who you ask for help because everybody has an opinion about mental health. And so you want to make sure that the people you are asking and entrusting really do have those tools to guide you.
That is so helpful. I think you hit on something really important that there are evidence-based ways you test for these things. This is not just some clinician going, "Yeah, I think this is this or that." I think that's very helpful for parents to understand that just like in other issues they might seek medical care, there are concrete and evidence-based ways that clinicians can help and know. So, Rachel, as they're doing these things with the professionals, what would you advise that the parents keep in mind with their kids at home as they're now embarking on this journey? It's a long journey of trying to help with the mental health challenges. Are there particular things that you would kind of want them to make sure they do or don't do as they're relating to their child at home?
Yes. um, I think one thing to understand is when the kids are having a reaction, that's not the time to try to sit down and have a conversation with them and to expect them to kind of engage in a logical conversation. By the time they're in the midst of some negative behaviors or adverse behaviors, that part of their brains that kind of turned off. And so they're feeling very emotional. So co-regulation is the key there where you want to keep yourself calm, even though it's really, really hard. So practice some deep breathing and things like that. And don't bombard them with questions. Don't bombard them with directives. We just want to all kind of remain calm. And if you can set up with the kids before they're having behavior, so on a good day, maybe you talk about what types of where they want to be to calm down. So like, is there a corner? I know a family that they had these huge walk-in closets, and so part of the walk-in closet had a corner where the child could take their favorite toys. They had cushions, they had books, they had little just like a little toolkit of coping devices. And when the child started to feel upset, they could be directed to go to their safe place. And again, that's before they've already escalated. So when you see it starting to happen, so on a good day, you can plan for what might happen on a not so good day. And the more you practice that, the better it's going to work in the moment. But yeah, the biggest thing is don't try to solve the problems for them, during an outburst, and try to co-regulate, even if maybe one parent has to tag the other parent out. That would be my best tip, I guess.
Yeah, yeah. I think it's probably you, Rachel, who taught me in those moments to try to think about the fact that your child is having a hard time, not giving you a hard time. I feel like somebody taught me that along the way, and it was a very helpful paradigm shift. The other thing I think that you
Yeah.
said that is so essential for people to understand, and I'm saying this as someone that it took so long to learn this, unfortunately, and it is the fact that that when our kids are completely blown out of their window of tolerance and just really melting down, that they do not possess the capability in that moment of having that logical conversation, like you said. That's a tough one
Yeah,
to,
absolutely.
but boy, is that important. So that actually brings me, Rachel, to something I think a lot of parents might think, which is, okay, how would you advise us if we didn't get this all right in the beginning? In the beginning, when things were starting to emerge, we thought they were just really being naughty, for lack of a better word. We didn't realize that they were really suffering. Sometimes parents can just feel so guilty about that and think that they've just blown it and it's over. How would you advise a parent who feels like that as they hear you talk about what they need to do and not do?
Yeah, I think the best thing to do is acknowledge that to your child, like, "Hey, I'm so sorry. Like, I reacted in a way that, might have been hurtful to you, and I didn't understand. I'm human too. I make mistakes." And just kind of own what you have brought to the situation, and then ask them, like, "How can I be of a better support in the future?" And just kind of, like, show them, "Okay, I get it. I was wrong. Um, I love you. I was scared." Like, you can be pretty honest about your feelings with them, and then just let them know, "Okay, like, look, how do we move forward from here?" And that just that little bit will go a really long way.
That's so, so helpful. Okay, so now we know something is up. We have maybe started the process with some professionals. We have apologized to our kids if we didn't handle it very well. We're trying to convey this. We're in this together, and there's some teamwork here. Um, but Dr. Thomas, one thing, and you hit on this, I love this. One thing that then often happens in this stage is that everyone in the world's got unsolicited advice for you. And as parents, we just live then with so much shame and blame and judgment that comes our way. What would you say to the parent that is just feeling all of the weight of that? Maybe they're hearing it from their extended family, from their church family. They certainly hear it from society. They certainly get the message, well, gosh, if you just did A, B, and C, then this would be perfect. How would you counsel a parent like that?
First of all, a lot of the parents that come in and their child is struggling have a lot of guilt,
Mm,
and they feel that they are the only parent in the world that is going through this. And so one of the biggest ones is to understand you're not alone, that there are communities out there, there's people out there that understand and support you. So that's kind of normalize that first for yourself because parenthood is full of guilt. And we will feel guilty about many different things that happen in our child's life. But this can be a very isolating experience if you don't acknowledge that truth, that there are other people who are going through it. And don't internalize the blame. If you do, then you can feel isolated and your guilt gets more, and then you can withdraw even more. And kiddos are very perceptive, even adolescents. I say kiddos, but I mean adolescents too. And they can feel that. And then they can feel a sense of shame as well if you start withdrawing when you don't mean to. But start acknowledging their feelings and start saying, you know what? We're in this together. And a lot of people will have many different opinions. So be very selective about whose voice you let in. Know the ones that mean well and ones that are very uncomfortable with mental health might have opinions because they're trying to fix the situation in the moment.
mm,
And so listen to the professionals, that use evidence based practices. Put a boundary up. It's not a rejection to the people who are giving you everything, but you can be very precise in who you're gonna listen to. And then, start looking at how you feel about the mental health as well, how you are internalizing it. What are you thinking about that? Is there a lot that you're putting blame on yourself instead of just kind of asking the people that can help you through it? Identify the groups that can help support you and then start seeking the help. Anchor yourself in the bigger picture.
mm,
Help your child feel seen, grow your own strength, and create a home where mental health is treated as health.
mm.
You would not treat anything else differently, like epilepsy with shame and guilt you would do the same with mental health because it's a biopsychosocial issue. Biologically, there's things that contribute. Psychologically, how we deal with things in our home, in, social media, all the influences that are coming at our kids affect them. And then socially, what's going on? It's a huge picture that's not only that is not to put the blame on the parent.
That's so helpful.
Don't
Rachel, what
minimize
would
it.
you add to that?
Yeah, I mean, she kind of was hitting the nails on the head right there. You know, uh, I always try to talk to people about how if what has worked in the past worked, like we wouldn't have jobs, right? And a lot of dealing with extreme behaviors is really, really counterintuitive, especially to people who didn't have those struggles when they were growing up, or their parents coming down on them or giving them consequences work just fine. Those aren't good. Like research has proven is not that doesn't work with kids with some of these mental health issues. And so, you know, trust your gut is counterintuitive, and it's going to err on the side of being loving rather than being punitive.
I love that. Loving rather than punitive. That is gold. Both of you. Thank you. Um, this brings me then, Dr. Thomas, to a huge issue. So now we've walked this path. We're sure that there is something more going on. We have built our team. We're having the right posture with our kids. And now comes the point of a recommendation about medicine for children. And for whatever reason, many parents have a deep, deep reluctance to medicate their children when it can often seem like society, maybe their church, maybe their family of origin is all aghast at even the idea of children taking medicine. And in fact, even as I'm saying it, it's kind of making me mad again at just how difficult it is for parents and kids then to access what they need because of these stigmatizing ideas that parents get bombarded with. So, Dr. Thomas, talk to that parent about medicine and whether they should accept a recommendation, for example, to try a medicine with their child who's struggling.
I would first say your hesitation, your reluctance makes a lot of sense. Absolutely. It's not only normal to question it, it's loving and responsible parenting to question it. And you would not be questioning it if everything else was working. I mean, you wouldn't be sitting before me if everything else was working. And you have gone down that path. You've sought out the therapy, you've sought out the help, the diagnosis. That's what we do as child psychiatrists as well. And a lot of times we can be called, medication pushers, or you just want to make my kid a zombie. You want to change their personality. But trust me when I say this, that is the last thing child psychiatrists or psychiatrists are trained to do. We are trained in all those other modalities as well. So we, of course, want to discuss that with you and have the process moving forward. um, Mental health conditions are medical conditions, right? So if you had a child who had a seizure, you would not sit before me and say, I have a lot of guilt. I'm questioning this. So trust the professionals that you brought them to. And because they will do a full diagnostic evaluation and make the right recommendations in methodical order. Um, we treat it holistically, I guess is what I wanna say. And medication is a tool. It helps therapy take more effect. It helps the child engage in school better, helps them function in social situations, but it is not a cure-all. It is not, "This medication is just gonna fix everything and the world is gonna be brighter." We would all be on it, right? But it takes hard work and it takes family intervention, and a lot of parents feel like, "Well, I need to pray harder." And they're being told this often, "I need to pray harder." That's where you put up your boundaries even more. You don't have to tell people if your child is on medications. You don't have to share that. that is a very personal topic between you and your child, and it's decided upon in a very comprehensive manner.
Mm. Rachel, would you pick up on that? I love the point about how medicine interacts with therapy and is a component of an overall approach. Can you elaborate on that a little bit about why medicine helps your therapy, for example, work better with a child?
Yeah, absolutely. So, the medication can kind of put their brains back online, so that what I'm doing, the things that I'm talking to them about, the things that I'm teaching them can kind of sink in a little bit. If they're at a point where, as Dr. Thomas has said, like they've already she's taught me a lot of things that you try first before you try medication. So physical therapy, occupational therapy, um changing their diet, like looking for dyes, looking for sugar, like all the things that you remove. So when you get to the point where the child does better on medication, which some of them are even protective, Dr. B has taught me that as well. That's just giving their brain what that needs, like that little bit of a break. Like it pumps the brakes a little bit for them because they can't do it themselves. So that when I'm engaging with them, or even a parent at home is engaging with them, they have a little bit more of time before we get to the point where the brain goes offline. So we have a little bit more of an area, where we can kind of get to them before it goes too far.
You
That
mentioned
makes sense.
And
physical.
I wanna add
Go
that
ahead.
medicine is one of God's provisions,
Mm.
right? It's not an either or. It is He has made Rachel and I and you as well to 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 speak truth, to
Mm.
treat. So not looking at it as two opposite sides of a coin, but it is a tool He uses as well.
I love that. Every good and perfect gift comes from
Absolutely.
above, and medicine is a good and perfect gift sometimes, and is exactly what is needed. I did want to ask one clarifying question. I heard you mention physical therapy and occupational therapy, and can you just give a little bit of an example of how that fits in here? Because I don't think that's something that people think of naturally when they think about mental health challenges.
Mhm. So I think about it a lot with the younger kids, the really young ones, because they have all this energy and all of these things that are happening inside. They don't know how to identify them, and they don't know what to do with them. And an occupational therapist is really good at like talking about it in a way that is meaningful to the child. So a lot of times I hear them talk about your engine. Your engine's running too fast. And what does that look like when your engine is running too fast? What does that feel like in your body? So it's really kind of focusing, helping them gauge what's happening in their body, and then giving them some skills to use. I don't know if Dr. B remembers this one boy that we had, but we had him army crawling down the hallway because he would get so just like tight and so furious. But if you could engage him before he went offline and doing some strenuous exercises, it all that exertion helped his whole body calm down. And then we were able to be like, all right, buddy, like now let's go do something together. And it would get him kind of back online and willing because you're playing with him too, right? So he's like, cool, you're playing with me. And it all kind of ties in together. Would you want to add anything, Dr. Thomas?
Just that, occupational therapy, really helps with those kiddos. You can't identify why they are getting so dysregulated, right? Could it be a sound? Could it be the lights? And they really help evaluate that. If a parent comes in and says, they don't like the texture of their clothes, they're really picky ears. If they can't really verbalize why they're so upset, so it takes a lot of observation and training from other professionals, like we've talked about, to help with that regulation as well.
Yeah,
That's
absolutely.
very helpful. That's so helpful. Rachel, I want to come back to you and bring up the next big topic that I hear from parents about a lot, which is what do we do about the issues related to schooling? So, when our kids are not well, from a mental health standpoint, um, the schoolwork, the homework, the stress, the pressure, they just seem to not be able to take it. And so I think a parent often feels like in their gut, there's just no way. I need to focus first on the mental health things, but there's so many voices and so much pressure that says the opposite. That no matter what's happening, you just
Mhm.
got to get them through school. Help our parents think through the best ways to consider all of the options in front of them related to schooling.
I want people to understand is like no worksheet or no homework is worth losing connection and rapport with your child. Kids, not every kid, not every person is going to be the president of the United States or go to a Ivy League school. So you have to decide what's more important to you, like that they're getting healthy with their mental health or they're keeping up with everybody at school. There's so many alternatives now to schooling that I would just really strongly encourage people to advocate for their kids and to listen when they advocate for themselves. And sometimes the only way they know how to advocate for themselves is with their behaviors.
Mm.
So when you see some behavior starting to come out, then you start asking questions and getting curious about where that's coming from. And with some kids, it might just start with like their stomach ache. I have a stomach ache or I have a headache all the time. And you notice that it's always when math is happening or when there's a test or things like that. So talk to your doctors.
Okay, so we're not going to ruin our children by us addressing the mental health first and understanding that the school and the education can come. That is such an important message that I know I needed to hear, and I know so many of my similarly situated breathe moms have needed to hear. And Dr. Thomas, I assume, do you agree, disagree, additional thoughts?
I think Rachel and I and you are all in lockstep with this. There's so many different ways to educate your child nowadays in the school. Just make them a partner. Know the laws, know your rights, and just make the school a partner. And they can help evaluate with you the best education that your child can learn from and not dysregulate. Because if they're dysregulated, they're in reptile brain and they're not learning anyways.
It's such a good thing to know.
Mhm.
Thank you for giving us permission to prioritize connection and relationship with our child and their well being above their book knowledge. It isn't that schooling isn't important, but boy, oh boy, their well being comes first. So thank you for giving that permission. I want to turn Dr. T to something now that can be very, very difficult for so many parents, and that is okay, we've been doing all the steps, we've been doing everything we can in the ways that you've described, but things are continuing to escalate with our children's behaviors. And now we've got real safety issues, and we're looking and agonizing over the fact that may need some out of home care. Can you walk a parent through, what should they think about when they find themselves in that position?
So when you are in that position, you have to acknowledge the truth that the emotional toll of caring for a child with significant mental health needs can be overwhelming and not only impacts the child, but has impacted the family, the siblings, and everyone around. So when you are sitting before a professional contemplating this, we know that you have gone through probably one of the toughest moments in your life. So just want to acknowledge that fact. And when a child's needs cannot be safely managed in the home environment, because we know that parents are the best place, right? A home is the best place for the kid. But when you are acknowledging out of home care, you know you cannot safely care for that child. So when there's many different levels of care. There is inpatient care when they are acutely suicidal, homicidal, they can't take care of their needs, they're aggressive. That's when you need to seek outside help and look at hospitalization so that professionals can see them 24/7, give you a great diagnosis and intervention, and then set you up for success upon discharge. Because a lot of times when kiddos and adolescents come in, they don't even have those support systems. So that was something that can be established and placed on a fast track. There's also what's called partial hospitalization, where maybe they don't need inpatient, but they can go to um, a program where they're seen by therapists daily, have a psychiatric evaluation, but go home at night. There's also intensive outpatient, kind of like the lower level of care for that. And then once those resources have been tried, then you might have to look at residential, which is an extended period of time outside of the home where the kiddo can have longer periods of time to regulate their emotions and have longer periods of time with therapists and, you know, occupational therapy and medication changes to make sure that when they come home, it is safe. It's safe for everyone in the family because it does impact not just the kid, but everybody.
Mm. That's so well said. There is so much shame put on parents who use out of home care to help their kids heal. One of the things that was the most important for us was the realization that our kids, to be kept safe and to be kept alive, needed line of sight supervision. And that is just not 24/7. And that is not something a family can provide. And so, thinking about it in terms of what does a good parent do if my kid has a kidney problem, I can't fix the kidney problem at home, but my job is to find the best possible kidney care for my child. And so I like to encourage my peers to think about it that way, that you are framing it for them that way, that you're framing it for them, that you're going to, leave no stone unturned to get them what they need so that they can get back home where they belong, healthy and happy. And I think in framing it that way, it does help them feel less rejected, because when they're in residential or in acute inpatient, or you're having constant family therapy sessions and phone calls and all of those things. And I think if a parent can frame it like that, at least for us, I felt like that was the one thing, maybe the only thing we ever did really well, in that our kids didn't seem to they seemed to not think we were trying to abandon them, but they might not have liked it, but we were trying to get them what they needed. So I just think that's tremendous permission that you've given to parents there. And I just thank you for that so much. I want to close here then with the last thing that transitions from that, which is oftentimes when they do go into out of home care, excuse me, there is such a relief for the parents and for the siblings. And that brings me to the issue of siblings. We agonize as parents about the fact that our more healthy siblings often are not getting what we wish we had to give them because we are so triaging the kids who is most sick. How would you advise parents to make sure they're doing the very best with the well siblings, both when the child goes out of home for care and when the child comes back? How can parents help facilitate and maintain the relationship still, with those siblings?
Rachel?
I can do you want me to take that one? I think one of the ways to do it is to just acknowledge with that child that what they're dealing with is also hard, and that you're there for them, you're part of the team, they're part of the team. Make some special time that you can do stuff just with that child. Because the other child is getting a lot of attention, and sometimes it can look like they're getting a lot of attention for all the wrong things. Um if you don't understand the concept, and other children might not understand that. So letting them have some open and honest conversations without risk of being judged or told, well, that's your brother, you need to love them, things like that. Yes, that's true, that's obvious. And right now their brother is hard to love, so and it's okay and safe to be able to say that. At the foundation, I even will allow siblings to come, I put them in separate groups or whatever, because they also need to learn some skills to manage their own emotions and their own kind of guilt and shame or anger or sadness that they have. So looking for some outlets for them that might be therapeutic is also a good idea.
Fantastic. Dr. Rebecca Thomas, Rachel Britton, you are two of my heroes, and I am so grateful that you took the time to share with our parents today. And hopefully, we'll talk with you again in the future. Thank you, ladies.
Thank you.